Bismillah ar-Rahman ar-Rahim. My dear MRCS candidates, my name is Dr. Muhammad Omar al-Farouk. I'm a consultant vascular surgeon and have been an examiner in the Royal College of Surgeons of England for the last 15 years. I used to examine in a lot of places, Cairo, London, Sheffield, and other countries other than Egypt and United Kingdom. And in the last run of exam, a candidate came to me in a communication skills station. And he was a good candidate, but he didn't know the basis of communication skills. It was a station of taking history. We usually provide paper and pens for the candidate to write the history in an accurate way. This is usually the professional way of doing it. He didn't take paper and pen. And then when he started to communicate with the actor, it did mention during the history that her mother has died out of cancer. And his comment was nothing. Not even appreciation. I feel very sorry for that. Can I help in any way? It's really, I feel very sad. Can I help? He didn't do any of that. And also, the patient was concerned that her abdominal pain is due to cancer. Again, he did not deal with the patient concern. So obviously, the candidate, although he knows good knowledge about surgery, but he was missing a lot of communication skills. And in this station, you lie with a lay examiner. So I examined the candidate with a lay examiner, which is not a doctor, but he is assessing his communication skills. Unfortunately, this candidate has failed. But what really made me feel bad that he was smiling at the end of the station that he has done it. He has passed, that he's done good, and he will pass his exam. So even not only that he has failed this station, but also he did not realize that he's failed. At that time, I really felt very, very bad for this candidate. And the story has been repeated multiple times. So I thought, what if I, as an examiner, made a platform that candidates can test themselves, know how they perform before they go into the exam, because the exam is not cheap. It's around 1,050 sterling, which is quite expensive for a young doctor in his career. So this is the aim of my project, and I will start by the first lecture of the product of the course, which is how to pass MRCS Part B safely with examiner and artificial intelligence help. Lecture number 1. My name is Muhammad Omar al-Farouk. I'm a consultant vascular surgeon and I am also independent medical examiner. So this is the story of this course. I have created a group on Telegram just specifically for this course. This group, you can reach it if you just go with your mobile to this QR code. This is a Telegram group that me and the candidate for MRCS exam will communicate. And I will send this lecture into a link into this group. Why this group on Telegram? This group is for us to change information, to get questions and the answer from me. As I've mentioned, I am examiner in the last 15 years. I have learned a lot of my examiner skills from Professor Shireen Al-Hariri. He is an examiner in Malaysia, and he's very well known for his excellent courses for MRCS. And the aim is, I really feel bad when some of the candidates don't pass. So this platform is to tell you if you are going to pass or not to pass. It's not going to teach you how to pass or how to study for MRCS. This you go to the official website of the MRCS link in the Royal College, where you can download the books, syllabus, all what you need to study. But after you study, if you want to know is your skills good enough to pass or not, this is a platform for you. It always hurt me when some of the candidates don't pass, and they are quite a big number in Egypt because we now do the exam in Cairo 3 times a year. And each time we have around 10 days, and each day we have around 40 candidates. So you can see there is a lot of numbers in the Egyptian examination suite. I hope this group will help you to pass MRCS. I will create a virtual OSCE station, which means you as a candidate will sit a station. I will either play the role of an actor or the role of the examiner, and then we record your performance over the 9 minutes, and then we play the record, and then we see how you can improve your skills in passing the MRCS. I will also use artificial intelligence. So the aim of the group on Telegram is to provide MRCS candidate who is going to perform the examination and hopefully going to pass this station, how they can improve. So these are the candidates who either booked the exam over the next 6 months or already planning to go to the exam as soon as they are ready. And this is the aim of the group. Who should join? Candidate ready have paid the fees for MRCS Part B. Let us test your knowledge. Know if you are good enough to pass or you're missing some part of it. A candidate already paid the fees waiting for the exam. Candidate preparing for MRCS who have just passed MRCS Part A and eager to go quickly to Part B and start to practice in United Kingdom. I will speak first in this lecture about some basic information about the MRCS that is important for all candidates to know. So the first point I would like to clarify that I will never break the examiner code of the Royal College of Surgeons of England. We have an examination, we have a code of conduct as an examiner, and I will never cross this line because the Royal College will be observing my work, and my aim is to help a candidate to pass. And there are, which is definitely one of the role of the examiner, is to participate in teaching trainee how to pass MRCS course. And these are the 4 conditions that should not be crossed by any examiner who want to perform a teaching course for MRCS. The number 1 out of the code of conduct, examiner should not teach 4 weeks before an exam is happening, which in my case is true. Examiner must not use any material used in the exam. All the material used in the exam is confidential, and none of it will be revealed in this course. Examiner must not use privilege of knowledge to favor some candidates. So, although I have participated in creating OSCE station and creating scenario, but I'm not at all in charge which OSCE station will come into the exam. So I will not be showing any privileged knowledge to people. Examiner should also consider conflict of interest being involved in ownership or commercial courses. So this course is free of charge. This course hoping for all candidates to pass safely MRCS exam. It's a big investment in money and time, and I don't want it to be wasted by simple mistakes. Just know the strategy of the exam and what measure we are measuring your performance. So this is important. number one for all you to know. Now, the purpose of MRCS is for candidate to determine that they have acquired the professional knowledge, skills, and attribute required to progress into specialty training surgery. So instead of becoming core trainer, CT1 and CT2, you will go to a specialized training, ST3, ST4. You will not get ST3 job without passing MRCS examination. And it tests your level of competence and that you are ready for higher surgical training. The regulations, you must know the basics. Part A must be taken before going to Part B. And the candidates who fail Part B are not required to repeat again Part A. You have a validity of 7 years. And candidates who fail Part B required to reset the station, all the station in Part B. So if you fail, for example, in communication skills or in anatomy, OSCE station, you're not going to repeat them only, but you're going to repeat all the 18 stations. There is no time limit for the number of occasions that candidate may attempt to pass Part A, no limitation, but for Part B, you are only limited to 4 times. So you have 4 attempts to pass Part B OSCE station, and I hope you will pass them the first shot. Secondly, in the regulation, it's recommended that Part A should be taken by CT1, CT2, you should pass, and Part B should be taken before you start ST3. And then you will be able to go and work in United Kingdom to get a GMC registered after passing English exam, which is OAT, English for overseas doctors. You need to pass it, and then you get what is called ID check. During COVID, ID check used to be done by email instead of traveling, but now it is back again. You need to travel to go to get an ID check, and then you start looking for a job in United Kingdom. There is no requirement that candidates are in recognized training schemes. They will not ask you that you are part of training. So you can apply if you are a graduate of Egyptian, you just passed your MSc degree, your master degree. No need even to pass master degree. If you have just graduated, you got enough experience in general surgery and special surgery, then you can pass the exam. The exam is in a format which is called OSCE examination. And OSCE came from the Miller Pyramid. Miller Pyramid, if you want a surgeon really to assess him and give him an exam, you're testing these 4 parts. You're testing his knowledge that he knows, and he knows how, which is how he apply his knowledge. He show you how he apply his knowledge, and then he does it. So the Part A exam will test the first 2, know and know how. But the OSCE exam will test the second, which show how and does. So, for example, incision of an abscess. You must know the information about the abscess, how it is formed, the pathology. You must know how it should be treated by drainage and how to drain an abscess and how to respect Langer's line. And then you show me how you can perform abscess drainage, which is shows how, and then you do it. And we have a plastic mannequin that you do the suturing, abscess drainage, ligatures, knotting, suturing, all this you show me how you actually does it. And we give you a lot of mark on how professionalism it shows. So this is the OSCE part or part B of MRCS. And all depend on the Miller pyramids. Now, the standard aim to generic surgical trainee who may be in core training, want to advance, they have already passed the Part A, so they are eligible to go to Part B. They have completed their core training, CT1 and CT2, and they are ready to go to ST3, but they must pass this exam, and this is the standard. In United Kingdom, you will not get ST3 job without passing MRCS. Any of the four Royal Colleges is fine. All of them are comparable. All of them are being audited and being monitored by the intercollegiate examination board, being assessed. So all of them have the same level of difficulty. There is no easier Royal College rather than the others. Not London is more difficult than Edinburgh. No, it's all being regulated to be exactly the same. The syllabus, you need to read the syllabus of the MRCS, and the best website is the MRCS website, which is by the Royal College, which really give you all the syllabus, what you need to read, and what we're assessing you about is all being mapped by ISCB. Now, in the OSCE exam, is 18 stations. So you will go into different scenario. Mainly it's an objective, structured, clinical examination. And this is the name OSCE come from. If we take it, the objective, you are asked to make judgment based on what you see. So I will get your patient with abdominal pain. I will see how you examine him, how you deal with the patient. You must not prompt in most circumstances, provided the safety and comfort of those involved and not prejudiced. So we'll get you an actor. We see how you can deal with the actor, how you communicate with the patient. You must not make assumption about the candidate intention. This is for us as an examiner. We don't make assumption that if you are from this country, your level is so and so. No, we all as an examiner go into diversity and equality training. We will not go into the exam without passing this training to treat everyone equal. It's a structured exam, so there is a structured steps that you need to go through in each OSCE station. The outcome for the candidate is based on the composite judgment of many observers. So in each station, there will be one examiner. So you are being judged by 18 examiners. There is no veto station. So if one examiner have failed you, you still can pass. If you pass 17 OSCE station and you failed in one, you still pass. So this is the way it's being structured. This exam is really very reliable. It is the best the human can ever make to be fair. It's a fair exam. I have seen it in London, in Sheffield, in Cairo, and different countries. It is the same. All examiners are not from one country. They are multinational. Different countries, different ethnic background, different religion background, and they are all being controlled by intercollegiate examination board. All are being judged, all are being analyzed, and it's really one of the best fair exam that I've ever seen and participated in. The marking scheme will be two parts. One, you get grades of your tasks that you have performed. And secondly, you will have either fail or pass or borderline. They don't necessarily goes to each other. Mostly if you get a high mark, you get a pass, but sometimes you get a fatal mistake that you fail in spite of having not bad marks. So these are two ways that we assess you, and I will show you how we do that with the virtual OSCE station. Now, in the final analysis, the benefit of the doubt will be always to the patient and not the candidate. So if there is benefit of the doubt, we always prefer the patient or the actor rather than anything else. Now, clinical, because we judge you in all the stations are designed to show how clinically. So show me how you do suture, show me how you do knots, show how you drain abscess, show me how you communicate with patient, show me how you get consent form being signed, and so on. All the scenarios are being conducted to be is continuous practice of the SCT 1 and 2 and ST3. They are also planned to permit candidate to demonstrate their behavior and not to be prompted. So it will show you how your behavior, and always be careful that examiner will not show you any facial expression. This is called prompting. If I nod my head like this, or say yes, then I am prompting you to say the answer that I want. But I will be having a mask face. And a lot of candidates don't know how to deal with mask face. And the mask face for them mean they have saying something wrong, something very bad. But you must get used to this system of mask face. And the examination, this is a test to demonstrate your knowledge and your skills, combination of both. And it will be mapped by the OSCE with part A and part B. And this is the level that you will be eligible for higher training. The final analysis who deserve to pass should be done with the collective opinion of all the examiners. And those who fail more than one station will fail and will have to repeat the exam again. Benefit of the doubt always be given to the patient. And this is the structure of the exam. Now, for us to do virtual OSCE station, I will need a volunteer from you as a group. I want to volunteer to have OSCE station. And I will start by communication OSCE station, like taking history, like phone call station, because this is easily can be done virtual. So I have made a Google form. If you just direct your mobile to this QR code, you will fill a form with mentioning your phone number, your email, and that you are willing to take the OSCE virtual station as a test. It's a free test to assess you, to play the record, for other candidates to benefit from your mistakes, and to see what your level and what you will grade on this station. So if you are interested in having this test before you go to the exam, please do just stop the screen at this QR code and go to Google form and fill it starting from now. And I hope this is the end of the first part of lectures on how to pass MRCS safely. We will be doing virtual OSCE station. I will show you your grades, how it's being made, and what's your mistakes, and how you can improve. And I hope with this effort, I am helping my dear colleague, which I was in their place 40 years ago. I'm helping them to pass this hurdle in their career, to pass it safely, to pass it easily, and to progress in the surgical career. And I wish you all the best. My name is Dr. Muhammad Omar Farouk. I'm a consultant vascular surgeon.